Hey. Late last year, the state government announced the closure of Ward 4G, the eating disorder unit at Flinders Medical Centre, the only hospital in the state to offer 2- and 6-week programs to treat persons with eating disorders. Now, the government's attempted to justify the closure by stating they're not closing the unit, but moving it to the Margaret Tobin Centre. A move which some health professionals say will increase clinical risk factors such as the potential for sexual assault and violence by creating a mixed ward of eating disorder patients and those with severe psychotic illnesses. Joining me now to give an update on the future of Ward 4G, independent MLC Anne Bressington. Anne, thanks for coming on the program tonight.
Thank you for having me, Andrew.
Now, Anne, you had some questions for the Health Minister on the issue of 4G today. How did it go?
Yes, well, I asked my questions, and I think the main point about this is, Andrew, that just days before a rally was organised by advocates, some of whom had already suffered from eating disorders, Minister Hill obviously buckled under the political pressure and announced the establishment of a statewide review of eating disorders. Unfortunately, it was my suspicion at the time that this was just a political ploy to shut people up who were demonstrating and, starting to stir up in the community. And that was actually proven by an email that was leaked the day of the rally. And that says, once we have the outcome of the proposed model of care, we will be clear about the elements of service that will be required into the future. However, if patients inpatient beds are recommended to stay at Flinders, we do not see 4GP as being a suitable long-term option. So they've had this review, or promised this review, but the outcome is already decided before the review has even started. So they never had an intention, it's my belief, of retaining this ward.
What did the Minister say to that today?
Well, the Minister's not in my house, unfortunately. He's in the lower house, I'm in the upper house. So I'll probably have to wait about 9 months for a response to this question. But the fact of the matter is, it's there in black and white. That was a leaked email from Dr. Derek Wright, from Director of Mental Health Operations, and that email was leaked to my office, coming from him. So they had already made their decision, and that review process, regardless of what the healthcare professionals have said that are involved in this, the eating disorder program, the social workers, all of the people that are involved in treating people with eating disorders, regardless of their opinion, the government had made up its mind. And that is just what this government does, I'm sorry to say, with the sick and vulnerable of this community. Cut services, cut programs, and then spin it.
And in my opening comments just a moment ago, I talked about what some health professionals are saying, that moving 4G to the Margaret Tobin building is going to increase the potential for sexual assault and violence. But just want to clarify it too, because it's the over 18s who are going to be going to Margaret Tobin, isn't it? The under 18s, what happens to them?
Well, there will be no services, as I understand it, for the under 18s. No tried and proven method of dealing early intervention, prevention. This will be part of the mental health plan, I should imagine, to allow people so many visits to a psychologist before they're charged, or, it'll be melded into that in some way. But the intensive services that are needed for early intervention and prevention of this illness are going to be ignored. And what's been tried and proven to work for so many is being ignored by the health department, mental health department, and by the minister on this. We had a doctor who disseminated information about the closure and how wrong it was, who was threatened. That was later withdrawn after it went public. This government will go to no ends to save a buck, let me tell you. And the lives of our kids and the lives of the sick and vulnerable take second priority for this government at the moment.
How is the government going to protect we've talked about the under-18s. Now let's talk about the ones who are over 18, who, if Ward 4G does close down, and it looks like to all intents and purposes that's what's going to happen. It's clearly been stated by the state government that it's not seen as being a suitable long-term option. How are those young, vulnerable people over the age of 18 going to be protected in the Margaret Tobin building, in the Margaret Tobin clinic, rather?
Well, I don't know. I don't know how they propose to protect them from the sort of behaviour of people who are in psychotic states. And, I mean, these are sick, weak people who need intensive care, and they're being thrown into a ward where you've got people in psychotic states and worse that are roaming around doing what they do, self-harming. And you're right, I've had in my previous life as a drug treatment and rehabilitation, I had a number of young people who went to Margaret Tobin Centre because they were diagnosed with psychosis, and I tell you, they came out worse for wear. They were assaulted, and their lives were made miserable while they were in there. And these people with an eating disorder that are going to be thrown in there, as I said, remember, they are weak and they are sick and they are needing intensive care. And this ward, it's not the place for these people. It is just not the place for them to get the treatment they need. And I don't know how they would protect them.
What's your next move now?
Well, my next move is to follow this through with a letter to the Minister. I want to have a meeting with the Minister about this. But, you know, the most frustrating thing about this, Andrew, is that we can have meetings with healthcare officials, we can say what the professionals are saying, we can give them the evidence that their decisions are wrong. At the end of the day, this is about the bottom line. And if we can't find a way to save more money, which we can't, they will forge ahead with this, in spite of the fact that it's going to be detrimental to a very vulnerable group in our society.
Well, I wish you luck, Anne. I really do. What can the public do about this to voice their dissent about the situation?
Well, I'm going to be doing a motion on this when we come back from the 3-week break that we'll have after this week. I'm going to be doing a motion. I would like people to get active and write in about this and about the fact that, you know, this government is prepared to put the dollar before the lives of our children, and to express their angst and their disappointment in this government for doing that. So I can read those letters onto the record, because at the end of the day, it's the people that are going to change this, not me and not any other politician in there. It is going to be public protest and public participation in this that is going to make the difference.
Anne, thanks very much for your time tonight.
Thank you, Andrew.
Anne Bressington, Independent MLC.